A curved or phased array transducer with an abdomen exam type is used to perform a renal ultrasound exam. The kidney should be evaluated in two planes. The transducer is placed in a long axis orientation along the right mid-axillary line at the costal margin, with the orientation marker directed toward the patient's head. If it is difficult to visualize the kidney, a deep inspiration will move the kidney below the ribs for easier access. It may also be necessary to move the transducer proximally along the mid-axillary line to visualize the kidneys using an intercostal approach. Using this approach will result in rib shadow artifacts overlying the ultrasound image. Once the kidney is identified, the transducer is slightly rotated to adjust for the oblique orientation of the kidney. The transducer is swept from anterior to posterior to image the kidney parenchyma, which will appear hypoechoic when compared to the liver. The renal pyramids are triangular in shape and darker than the renal cortex. The renal pelvis will appear as bright hyperechoic echoes within the kidney. To obtain a transverse axis view, rotate the transducer 90 degrees from the long axis position. The kidney appears as a circular structure with a horseshoe shape at the level of the renal pelvis. The transducer is swept from the superior to inferior poles to evaluate the entire kidney.